Alright, welcome everybody. So today I want to talk to you about our last class of compounds that are important for you to know about, which are antiviral agents. And so when you're treating a virus, you have to go about it slightly differently or very differently than you would when you're trying to kill off an organism like a bacteria, or when you're trying to treat some ailment like pain, for example. And so when you have to treat a virus, you have to consider that the viruses are not really alive. Rather, they're using our machinery in order to reproduce and to then eventually destroy the cell. And there's two types of viruses that you'll come across. One is called a DNA virus. The other one is called an RNA virus. And that is the genetic material that they contain. The RNA viruses, those tend to be much more difficult to treat because once they enter the cell and their protein coat, what's known as the capsid, once that is removed and you just have the virus with its DNA or RNA, the DNA can be inserted directly into our genome, and that DNA could then be replicated by the host or by your machinery in your cell. But the RNA, that actually has to go through a process called reverse transcription. You actually have to take that RNA and make it back into DNA before it can be utilized by the cell. And that process, and the enzyme that does it, the reverse transcriptase, that process of reverse transcribing the RNA, making the RNA into DNA, that is really prone to errors. And so when you hear on the news, oh, well, HIV is really difficult to treat, or certain viruses are really difficult to treat, it happens to be because a lot of them are RNA viruses. And those RNA viruses can mutate or can change very easily. So a virus is not alive. Basically what it's doing is it's taking over the cell or hijacking it. It's replicating, and then it's destroying the cell in the process. It's basically filling up. It's utilizing the cell to completely make more of its own, and then the cell can't function normally. Now, certain viruses, they can stay around dormant in somebody's cells for a long time and be activated later on. A good example of that is what's known as shingles. Shingles is a form of the chickenpox virus that sits in people's nerve cells. So if you had the chickenpox, and you were infected with chickenpox and you had it, then a form of the virus will actually sit in your cells, and when you get older, something activates that virus, they're not really sure what, and then you'll get a flare-up of shingles. So our purpose is to really look at this and how do we treat viral agents. Well, let's look at some of the viral treatments that we can do here. So there are different stages where the virus will enter the cell, and you should know these for this unit. So the first one is attachment of the virus to the host cell, where it will bind to a receptor. You might have heard a lot about this with HIV. It binds to something called the CD4 receptor, and that is something in an immune cell. And so then once that virus binds to the actual receptor or the site on the cell surface, it will enter the cell, and then the virus will uncoat, and then the DNA and RNA will become, basically naked DNA and RNA, and then that DNA and RNA will then become part of your genome in most cases, and the virus will then use that DNA and RNA to make more components of itself, assemble the new virus particles, and then release the virus from the cells. So now, how does this work where we have these different antiviral agents? Well, we have ones that can treat influenza, and these will generally stop the uncoating of the virus or injection of the DNA and RNA into the cell. We have biosynthesis of viral components, including nucleotides, and you'll see that the acyclovir, that it will actually mimic a DNA base, and I'll show you that on the next slide. And then release of the virus from the cell, that's where Tamiflu works and Relenza works. So if we look at some of these molecules, what do they look like? So here are the two HIV treatments. And you can see that these mimic base pairs. If you compare them to the actual base pairs that they mimic, you'll see that they look very much like that, and they'll mimic those base pairs. And then I also mentioned release of the virus from the cell. Well, here's that Tamiflu and Relenza. So a lot of you have taken Tamiflu, and so you have to take it early in the process before the virus is spread through your cells. If you take it early enough, then it will prevent that the influenza virus from leaving the cells that it's infected, and it'll be a good way to combat flu. If you wait too long and the cells have already released a lot of the virus, at that point it's not really that helpful. Okay, so looking in detail about HIV, the virus that causes AIDS, the acquired immunodeficiency syndrome, looking at this virus, it is one of those retroviruses that I had mentioned before. That means that it starts off as RNA and then it gets changed into DNA. And the problem with this is that the enzyme that does this, that changes RNA into DNA, is very prone to error. That means that there's a lot of mutations that could take place. Now, because of that, if you develop a drug against HIV and it targets a specific part of it, if you're taking that drug and it seems to be effective, and then the HIV virus mutates, then suddenly, or over a period of time, that medication will not be effective. Now, if that person who has that mutated strain then transmits the disease to other people, those other people will then be infected with the resistant form of HIV. So a lot of times what they'll do is they'll sort of apply this broad spectrum approach called a cocktail. And so what they'll do is they'll try and combat multiple parts of the virus reproduction cycle. And so then they'll be able to essentially eliminate most of the virus and cause or allow the person to live basically symptom-free. Something really interesting about HIV that has come out recently, and it's still a little bit controversial, is this PrEP. And basically what this is, it's two antiviral drugs that are mixed together. And this approach, if you're taking this and you are in a high-risk category, like maybe that either your partner has HIV or you are at risk because you have multiple partners, sexual partners, what ends up happening is if you take this PrEP, it greatly reduces your risk of actually getting HIV. Now, it's not a cure, and people are worried about this. It's controversial because people think that, okay, I can take this treatment and that will actually allow me to then, not have protected intercourse. And that's just not true. But this is, sort of where they're at now. They haven't come up with a vaccine for HIV. Instead, they're trying to sort of prevent, the spread of it by using sort of a, preemptive approach. So, so this is, one idea behind preventing HIV. Now, in case, you asked me in class, well, what is this drug called? This is called Truvada. And the two drugs that are part of this in the same pill, one will inhibit the DNA synthesis, and the other, for all those bio people out there, it inhibits phosphorylation of enzymes. So, really our best defense against all disease is to actually try and, prevent it. How can we stop diseases from actually spreading to begin with? The first thing that we can do is we can think about educating our population. So if we're educated about the transmission of the virus, that will actually be really helpful in us, being able to stop people from getting the disease. If they know what causes it, they can avoid getting it. Some education would include, if it's a sexually transmitted disease, the use of prophylactics such as condoms that will prevent the spread of infection. Those happen to be very, very effective if it's a sexually transmitted disease. Other possible avenues would be vaccinations. If there's a vaccination against something like polio, for example, that vaccination would prevent people from getting the virus. And then also just simple, keeping things clean, sanitation, hand washing, those types of approaches can help to spread infections. A good example of that is on a cruise ship. The Norovirus is this really nasty stomach bug that spreads very, very quickly. And so if you've ever gone on a cruise ship, you'll notice there's people standing around who have, sanitizer, and you want to sanitize your hands, especially before eating. You'll also notice in the bathroom that there's a garbage can that's right by the door. And so I don't know if you've ever realized this, but you wash your hands, you dry your hands, and then you can take that towel, that paper towel, and you can open the door with it and then throw it out at the door. That's better than throwing out the paper towel and then touching the door. If somebody didn't wash their hands before you, you've now touched a dirty door handle, and now you're at risk of catching whatever virus or bacteria they might have had. Now, something that the IB wants you to consider is environmental impact. And so some of the environmental impacts that you need to be familiar with is called pharmacologically active compounds. So this is where, medicines that are still active make their way into the waste, into the landfills, or into our water supply. Birth control was becoming an issue and still is becoming an issue because those estrogens that are being taken, they are then excreted in urine, and then they enter into wastewater and eventually water supply. Another example that you might see around is when different communities have like some kind of prescription drug collection, where they have a site set up that you can bring in your prescription drugs so you just don't throw them out. You want to dispose of them safely. Nuclear waste, it's called low-level waste. This is normally from some kind of radiation therapy. It uses cobalt-60. If you have cobalt-60 and you're trying to do radiation therapy for cancer, you have to store this underground, the waste products, the cobalt-60 that needs to decay and go through half-lives. You need to store that for many years. It's about 5 years per half-life for cobalt. We talked about antibiotic resistance. That's still an issue, and we need to consider that when we think about, using these different drugs and, what's the right way to use an antibiotic. And then organic solvent waste. So, when you have solvents that were used to make different compounds, how do you dispose of them? You need to dispose of them in a safe manner. Otherwise, you may have groundwater contamination, and that's not good. This is just showing you a quick graph of antibiotic resistance. The big one that's been in the news is MRSA. And MRSA is a type of staph infection. And you can see that starting from 1980 to now, this is a huge problem. About 70% of the strains are resistant to bacteria, to antibiotics. But you can see that most of the bacteria that we're trying to fight, they've all had an increase in bacterial resistance. And when your parents and your doctors are concerned about this, they have a right to be. And that's because of the fact that this is a real problem. We're going to have to develop new antibiotics. We're going to have to be more careful about administering antibiotics so that this doesn't become, a real global problem. The last thing I want to tell you about is green chemistry. And so the whole purpose of green chemistry, especially in the context of medicinal chemistry, is to try and reduce all these environmental impacts. So we want to minimize toxic chemical use. They have this thing called the atom economy. And this sort of, you look at all the products and reactants, and you want to try and minimize the amount of reactants left over that might be toxic, or the amount of side products that are formed that are toxic. The other thing is, and the last thing is using biotechnology. And so, a good example of this was insulin. Originally, to treat diabetes, porcine or pig insulin was used, and that had a host of side effects, but also, you had to harvest it from animals. Now, all the insulin that we use actually comes from bacteria. We are now bioengineering it. And the bacteria are making the protein insulin, and then we're isolating that insulin and purifying it. So this is a good example of taking something that used to be, produced from animals and plants, and now we are using it for, we're doing it artificially, basically. Another example is Taxol, and that came from something called a yew plant, and the yew plant, is a pretty rare plant. You want to try and produce that without using the yew plant. All right, thanks so much for watching. We'll talk more about this in class and discuss some of the, environmental and societal impacts that some of these different compounds have on our society. Thanks so much.